Good evening. It's Elaine Lindsay here with Catherine Corey of the Recovery Academy. Hello, Catherine. And we're here with Catherine and her guest, Dan Rathwell. I'm going to turn the floor over to Catherine in just a second, and we're going to get into this week's topic, which is concurrent disorders.
So I guess I'm going ahead, Elaine. I was going to say, and if you happen to have any questions as we're going forward on this webinar, please use hashtag #TaughtRecovery on Twitter, and we'll hopefully be able to answer any of your questions. Or you can actually email us also at info@recoveryacademy.ca. So if you have any questions. Oh, I guess I'm going to go forward ahead. I'm going to start off by doing a little definition of concurrent disorder, because one of the challenges when I first became involved with the mental health and addiction system was that particular term I came across. And it's defined differently here in Canada than it is in the US. In Canada, a concurrent, or now they call a co-occurring disorder, is when you have a diagnosis of a mental illness and you also have a substance abuse issue. In the US, they call that a dual diagnosis, whereas here in Canada, a dual diagnosis is a learning disability or a developmental delay and a mental health issue. So with no further ado, I'd like to actually introduce my guest, who is Dan Rathwell. Now, Dan and I met about a year ago at the Royal Ottawa Inspiration Awards, where Dan happened to win an Inspiration Award. And he certainly, after hearing his story, has been an inspiration to me. He is a dedicated advocate for recovery, an educator, a motivational speaker, and an expert in the field of substance misuse, prevention, and treatment. He is an international certified alcohol and drug counselor and a certified substance abuse professional, amongst a number of other things. But it is really my pleasure to have him here this evening to talk about concurrent disorders. He has a really interesting story. So Dan, I know you shared a little bit with me, and I mean, I have an interest because I did enter the system first believing my son had an addictions issue, then to hear he had a mental health issue, and then back to, well, he needs to have the addiction issue taken care of before we can do anything with the mental health issue. And I got really, really frustrated. And I know you have a bit of a story around this too. So I'm wondering, can you tell me, well, I'll say a little bit of your beginning, because I know you shared with me that you had an early experience of you looking for help.
Well, thanks very much for having me, Catherine. I appreciate it, and Elaine as well. Everybody can hear me okay? My voice is good?
Yeah, you're great.
So my personal history, I came into substance use very, very early, at a very young age. I was about 12. And my family, of course, identified quickly, rather rapidly, that I was in trouble and advocated for me to try and navigate the addictions and mental health system at the time. We were very separate and in silos then, so I can understand the experience that you went through with your son. You know, and substance use often mimics a mental health issue, right? Or it hides the symptoms of a mental health issue, so it becomes very difficult, perhaps, to diagnose. My own personal story, I was misdiagnosed with a bipolar disorder. I was kind of streamlined through the mental health system at the time, which was, of course, in the silo, and it wasn't effective for me. And it was a long struggle. It was 17 years before I had the ability to kind of take all of the things that I had learned over the course of 17 years and put them together to like fit the recovery plan that I needed to be able to sustain and maintain moving forward. Yeah.
So what was your experience when you first asked for help?
When I first asked for help, I think that my experience was one, I was pushed to ask for help for sure. It wasn't something that I was doing for myself. It was something that I was doing for others. But even when I came to the point, it was probably in the late 1990s, and when it was something that I knew I needed to be able to change, there wasn't help. for someone like me. It wasn't a mold that I fit into. I was redirected. There was no right door. I had to go here. I had to go there. It was very frustrating, very challenging. And of course, I was inside the criminal justice system as well. So certainly no supports in that area either.
So it sounds to me like there weren't a lot of people reaching out to you or engaging with you to give you some kind of support or guidance or help. So what was kind of the turning point for you?
The turning point for me, I think, was that I had been away from my family for about a decade. I hadn't seen or spoken to them other than to try and manipulate in some way, shape, or form, probably money from them in almost a decade, and I was very much sick of living that way. I was living in British Columbia, where the addictions and mental health system is very different there than it is here. There are certainly more resources there, and I think I was just very fortunate at the time, the system that I came into there, and the network that existed. They were much more able to support someone who, because it was still at that time that I had been diagnosed with the concurrent disorder, substance use disorder, as well as concurrent bipolar disorder. So they were much better off to support that type of concurrent disorder for me. And it was about 2 years into my recovery process before I was ready to be able to do the work to really take a look at the mental health side of that and look at whether or not it was an actual diagnosis or something that was perhaps misdiagnosed, and working with the professionals to support me in that process of change.
Well, I know you talked to me a little bit, because when we had discussions about it, was like, because I was going, okay, so do you need to, give up an addiction, kind of go cold turkey in order to get the diagnosis, or kind of what's that process like? Because I know in my case, my son felt that the medication that he was using, I always call the street drugs, were more effective than any of the pharmaceuticals that were prescribed for him. So he was really unwilling to give up what was working for him.
Well, that's just it. I mean, when we're talking about, and I specialize in substance misuse, obviously. About 20, maybe 30% of the clients that I see certainly present with a concurrent disorder. But the alcohol and the drugs that I use, certainly in my own story, and I'm guessing from your son's story as well, were always solutions to the mental health problems, right? Because it was providing an ability or an opportunity to get relief or to hide from pain or whatever it is. Those drugs were likely providing the solution to the problem at the time, and the medication that he was being prescribed just wasn't as effective, right? So why move away from the solution that's working to one that isn't? Right? I'm guessing that's what I'm doing.
Mm-hmm. Well, because oftentimes what we're hearing about is the focus on the addiction as being the problem. And I think that was one of the things that really confused me when I was attempting to look for some kinds of solutions for him, some things that might be able to connect to him and might be able to work.
Well, working with professionals who have an understanding that concurrent means that they're working, like they're present at the same time, right? So there's substance use and anxiety and mood disorders, or depression, or panic disorder, or persistent mental illness like schizophrenia. So dependent upon the professionals that you're working with, really knowing what they're talking about and understanding and having the ability to assess the mental health disorder accurately while working with the substance use disorder is extremely important. And because we're learning so much more and more about the brain and how to treat mental illness, it's really, really important that people are trained and have the ability to support an individual who presents with a concurrent disorder simultaneously. Like having one go one side and then work on the mental health issue often doesn't work, because the substance use is a solution, and working on the substance use is, of course, mimicking or hiding or co-presenting or what have you with the mental health diagnosis. So really working with an integrated approach is proven to be the best form of treatment.
Well, and I know that in the world, globally, there are some places that have those kind of integrated programs, but I'm not so familiar that we have that many in our region, in the Champlain region.
Certainly not as many as we would like to have, especially with the rates of concurrent disorders that we have, you know, individuals presenting with. So I think that around here we're running somewhere between 50 and 70% of concurrent disorders. So that means someone who presents with a mental health disorder 50 to 70% of the time has a concurrent mental health issue, and vice versa. So they're quite high. You know, we have a lot of resources in the community. It's about whether or not we have the professionals trained to support them concurrently, or the programs in place to support concurrently. So, you know, it's definitely something we need to have more of, and it's definitely something I think that the Ministry of Health and the LINs are working towards, but it's been a very long process, and a lot of people are getting lost in the gaps for sure.
Mm-hmm. So
Yeah,
what are
let me jump in as the lay person here. So you're suggesting that an integrative approach is best, but as a layperson who, say, my child is exhibiting symptoms that have us very concerned, we want to have the child looked at, and we don't know what the problem is. Maybe we found, you know, some substance, but we're worried that there's something else, because often as a parent you know that something's just not right. How do you approach that? What are the steps you would take, or in your estimation? Dan, I've heard a bit from Catherine already, but what would you suggest to a parent, a guardian, or a spouse, or someone that's looking for help right at the get-go?
Oh, wow. I think that the most important thing for me, and from my perspective and what I've learned, both personally and professionally, is that there can never be enough education. There can never be enough about talking to your kids. And if you're finding that you're have a concern about your child's mental health or a substance use issue, certainly talking to them, not bringing, I mean, there's a lot of misinformation around drugs. There's a lot of stigma and discrimination around people who use drugs, or people who, you know, have a mental health issue, and talking about that and allowing it to be okay, I think is primary. Looking for resources in the community that exist that can do an assessment is extremely important. Having someone talk to your children. I know that there are resources in the community that are right into the public schools and the high schools for sure. Connecting your kids with that. The biggest problem I think with youth is that, you know, they don't think that it can happen to them. They don't think that it's going to impact them, or they don't want to, you know, ally with the reality that they might be in trouble, right? Because of the stigma and the social biases that exist around addiction and mental health issues. So allowing it to be okay to talk about, allowing it to be important for them to talk about, not a taboo subject, I think is probably primary, and education is always key, right? Education is the most important weapon and tool that we have, for sure.
Thank you.
So I was going to say, one of the things that I found that I really needed to learn how to do was listen, because I had a lot of judgments or ideas about what he should be doing. I always have the mother thing about, this is what you need to do in order to have a good life. And so I was pushing a lot of my beliefs in terms of what he needed to do for a good life, and I wasn't really listening for what problems and challenges that he was having. And, you know, I always say, for me, it's been a 10-year run, and it ended up being, you know, there's some things as moms. For me, it was a relationship where he didn't feel like he was seen, and he certainly didn't feel like he belonged. And that was a message that he kept on delivering, and I just wasn't really hearing it. I wasn't really listening to it. And I found when I started to do that, I was more supportive of a recovery journey for him. And I don't know if that was your experience with your family, Dan, or not, but I certainly know for me that I really, really wanted to support him in his recovery, but I wasn't identifying it as his recovery. I was identifying it as the recovery I wanted him to have. And I was wondering if that played a little bit of an influence for you.
I don't know. I think that when I look back, because I was very young, and I think that it was a very different time as well. But if I look back on how my family advocated on my behalf, for me it was more about the social circumstances that existed in the access. So I don't think my parents were in the same place as you and wanting a particular recovery for me and the way that I wanted to do it being different. It's that they wanted recovery for me, whatever that looked like. They didn't really care, and I just didn't want it. So it was very, very different. I wasn't in a place where I was struggling to go through that process of change. And by the time I got to that place, I had, of course, done so much damage that their ability to remain and to protect themselves, the only way that they could do that was to remove themselves, right? It was to cut that tie. So they were in a place of saying, get well, but this behavior we can't condone and we can't be a part of any longer, right? So they didn't really try and tell me how to recover, just that there was something that I needed to do if I wanted to have them in my life. I've had many experiences with people who my recovery is very personal to me. It's something that I understand very well and what's in my life. But I wouldn't want to have anyone else try and work a program of recovery in their lives that was the same as mine, because we're all unique human individuals, right? We all have our own struggles and triggers and pitfalls and triumphs and strengths, and I think that working with the individual is extremely important in identifying what their strengths are and empowering them to be better tomorrow than what I am today. And that's the goal that I live by today. It's the goal that I work with around my clients, regardless of what they're presenting with. I think that empowerment is always good. It's always got to be client-centered for me, and I have to be listening to my clients to understand where it is that they want to go. There might be places that I'd like to see them go, but it's not about me. It's about them and their journey, and how do I support them in that process.
Yeah, so you mentioned something about that empowerment piece, that place of making choices and decisions, good choices and decisions for you, good, helping. I think you help clients work around that, making good choices and decisions. Is that part of something that you found in your recovery?
So I think that for me, my recovery needed to be about building barriers to my addiction and breaking down the barriers to my recovery. So when I identified the places that I wanted to go and where I wanted to see me tomorrow, oftentimes I had things that were in my way today. And I needed to be tearing those things down today in order to get where I wanted to go tomorrow. And I haven't seen much different in working with my clients as well. But those barriers need to be identified by the client, right? And their goals need to be identified by the client. It's just about working with them and learning from them where they want to be, right?
So was there anything, I have to ask you, was there anything in particular that gave you hope to continue on? I would say, because for me as a mom, and I know, statistically and challenging out there, one of the things that I heard early on in the journey with my son was that he had a high percentage chance of not making it. And that was pretty scary for me.
Well, one of the things that we have that can be really effective in that are the peer supports that exist. So there's substance use peer supports, there's Alcoholics Anonymous, Narcotics Anonymous, secular recovery, and life ring, and all of those. If you're looking at the RAP programs that exist around mental health and facilitated, so that peer support, so seeing others that have gone through similar processes and are doing well is certainly something that's empowering and inspiring for sure. That was my experience. I was very fortunate that that I was introduced to a bunch of people who had gone through similar struggles that I had went through, and that I had seen that their lives had changed, so that I knew that it was possible. I don't think that we see enough of that. I don't think we hear enough of those stories. I think that they need to be platformed from an addiction and mental health perspective at a societal level, not just within or between those who are struggling similarly, but a much broader, right into the very culture of our society, so that normal lay people, as Elaine would say, just know that it's possible. 1 in 5 people are going to struggle with a mental health or addictions issue in their lifetime, right? In Canada, right? So that's 20% of our population are going to struggle with an addictions or a mental health issue. So, the social stigma and the bias that exists around these disorders is something that we need to change, right? And I think that we do that by showing people that recovery is possible, right? By platforming those stories, by instilling hope. Recovery is where hope lives for people who are struggling with addictions and mental health issues. Right?
Yes, that it is possible. It's not necessarily, I would say, in the case of many, it's not about a cure for the mental illness. It's really about, from my understanding anyway, in my experience, it's about skills and strategies of dealing with symptoms. It's maybe new problem-solving techniques, or for me, and I have to say, in this process, I've learned how to have a better relationship, how to have a healthier relationship with my son.
Oh, absolutely. I mean, I look often at, for me, alcohol and other drugs were the solutions to the problems that I had in my life. And the problem with my solution was that it gave me more problems. And I needed to come up with alternative solutions that weren't going to be as consequential. And it took a lot of work, and it oftentimes takes a lot of work. And I think it's very similar with mental health concerns as well. For those that aren't now, for myself, I'm not personally qualified or competent to be working with individuals who present with a concurrent disorder of the likes of schizophrenia or something that's really, really persistent. Oftentimes those mental illness do need pharmacotherapy as well, oftentimes, in supporting an individual in that process. So so it's very different. Sometimes with a depression perhaps, or an anxiety disorder, that can be about different coping mechanisms and different strategies and skill building around a recovery, process of recovery, a process of change. It can be about behavioral changes. So again, meeting up with professionals who are long-term, who can case manage, who can integrate approaches with allied professionals to support people, I think, is really important, and knowing limitations as a professional as well. We can't be all things to all people. We have to know our limitations and know when we can work with clients to a place where we can transition them into that. I don't want people to become dependent on me. I want them to become self-reliant. That's recovery for me, right? With no fear, right? Having an understanding of, what their own innate strengths are and how best to utilize them for themselves.
Yeah, well, that certainly was what I was hoping for my son too, because I thought my role was, I don't want him dependent. It's like I want him to grow to independence. So I want to guide him to a good life, not dependent on me. And so this has been quite an experience for me, learning some new abilities and new skills and new ways to relate. Just on that, do you have any suggestions or words of wisdom to families, those who are journeying with their loved ones? I know we've talked about it, and I think you feel that there is a role for family in recovery.
Oh, there's absolutely a role. I know that, for me and my family, I was in recovery when I returned home, and I walked back into a place where they hadn't had an opportunity to heal with me in that early recovery process, in my own early recovery. So I walked in, and they were still very scared, right? They were still in a place where they were protecting. So I think it's really important that families engage in that process from the early stages, so that they're learning about the things that they can be doing differently, the things that are working. an example would be I've had youth who go away, they'll go away to treatment and they'll learn about how to make their lunch or how to do their laundry, and they'll return home, and now that they have that skill, they want to be able to utilize it, but once a week, mom's coming into the room and doing their laundry for them. And they're not saying anything about it, and they're not doing anything about it, but they're very, very frustrated, right? And then all of a sudden, there'll be some argument and some blow up, and because the family hasn't been involved in that process and the youth doesn't think that they have the ability to speak to them about that, they run and they relapse. And all of that could have been avoided had they just had the conversation, oh, hey, listen, I know I can do my laundry, and do it every Saturday morning at 8 o'clock when I get up, and it's going to be on the weekend. So if you're coming into my room, just leave my laundry there, right? And being aware of those little things often are the ones that become the most important, in my experience. Right?
Yeah, well,
do you have similar history?
well, yes, because I did the thing. Well, of course, my son has a very serious illness, but one of the challenges that I had as a mom, when he wasn't making sense, I said I would try and talk him into making sense. And I don't know if that makes sense. And I had to learn to be quiet. I had to learn to stop talking, to stop trying to get him to be able to answer questions that he clearly was not in a place to answer. So that was one of the things that I definitely had to learn big time, that that tact just was not working. And in fact, as I said to you before, I actually needed to listen more closely, because he really was trying to communicate to me. It just wasn't clear what he needed. So I had to kind of take a step back and go, hang on a second, what's going on here? And sometimes when he would get very, very angry, it was just because I was creating a space where he couldn't process, and he was getting really, really frustrated. And he wasn't in a place where he could say, Mom, just kind of back off, give me some space, because he wasn't used to that. And so I had to learn that to notice that when he was getting really frustrated, when it just wasn't processing, that I needed to stop using language. And I mean, that sounds kind of like, to me right now, fairly straightforward, but it wasn't. It wasn't at all. And it took a fair amount of practice for me to really start engaging him in a way that was easier for him. Yeah. And I know I was doing a lot because I've had a lot of anxiety and a lot of fear about what he was dealing with. But one of the things that I learned too was, how could I expect him to learn how to deal with his symptoms if I wasn't dealing with them? And I figure that as a mom, if I'm not dealing okay, there's there's healthy ways of dealing with behavior and unhealthy. And if I'm dealing in unhealthy ways, how am I expecting him to deal with it in a healthy way? So I noticed quite a difference when I started to get healthier.
Yeah, and that's just it. I think often, particularly with substance use and mental health issues, we talk about people that go into a crisis, and the response to that crisis is for everybody to surround the individual, to support the individual who's in crisis. And what we don't do is change some of the behaviors that perhaps enable the person to get that far down the path, right? And it's about treatment and support for the individual, but not about us, right? And not about our own self-care, our own education, our own understanding of what's happening. If you're, and the stigma associated with asking those types of questions also is a big barrier to recovery. Right? Because if I'm an individual who struggles with cancer, right? And I have a particular type of cancer, and my family is aware, what do? They go and educate themselves around how they can support me, right? Around the things that they could do differently, what foods I can eat, what I shouldn't eat, all of those questions are answered, and they advocate quite strongly for those things. When it comes to addictions and mental health issues, we don't do that, right? Why aren't we asking those questions, right?
Well, why aren't we, and why aren't we, providing families or those who are willing to do some of the journey with some skills and abilities to support I always say it in a helpful way, because as a mom, I always thought I was being helpful. But there were certain things that I was doing, and I was noticing, I was observing that, the outcome wasn't helpful.
Yeah. When I do this, this happens.
Something else I could do.
Yeah.
Hmm?
When I do this, this happens, and I don't like it when that happens. Maybe I need to do something different.
Yeah.
Right?
Yeah,
So,
absolutely. And for me, the most important thing, really, and I mean, I guess because he was my son, and I definitely did not want to lose that relationship. I had a huge fear of losing a child, and in the throes of a deep, illness or addiction, there is that loss. There just is not that emotional connection anymore, and that terrified me. So I really didn't want that. So I said, I guess I was one of those I was just stuck on really doing what I could to see that he didn't feel like he was alone. I don't know if you felt like you were alone at times, or you just you knew they were there for you, but there was something that you had to do.
I always knew that my family was there for me. I never felt removed from them in that way, but I had certainly taken steps to isolate myself from them. So did I ever feel alone? Absolutely. Was I ever isolated? I also struggled directly related to my substance use with depression quite often because my behaviors isolated me from society. And my biggest fear is that I didn't want to be. I was terrified of being alone, but I couldn't change my behavior so that I could not be. I pushed everyone away. Right? I mean, it was just through drugs and alcohol. They were the only solution that I had. I needed different solutions. I had started so young, and quit school, and I wasn't educated, and I had no life skills, and I had no work experience. And as I grew older, and those things were more necessary, I had less of them. So for me, it was all about retraining over a long period of time to kind of re-engage with those things that I either hadn't done or that I had lost along the way. And I think that that's really important. Again, I'll always come back to education, skills building, empowerment, identifying strengths, across the board, both for the individual who's struggling and for their families and loved ones as well.
I just like to, I said we're almost out of time or out of time, but I would like you to talk about, just as we're going to finish up, that during this thing you talk about having found your passion in life, the thing that you really feel like you're meant to do.
Well, I've always done it. I mean, I think that I'd like to change societal perceptions of what recovery actually is. I think that when we think about people who are addicts or have mental health issues or what have you, we often think about people who are still in that cycle. And what we need to remember is that people who are trying to access and that are in or that are seeking recovery are people that are on a journey of wellness and wholeness. And I think that at a societal level, I'd like to change and challenge that perception of what we think we know to educating around what we could be looking at differently. And I think that we do that through these stories and through these types of conversations. Your experiences as a mother in recovery, as a family member in recovery is powerful, right? It provides and instills and inspires and provides hope to those in similar situations. And I think that my story has the potential to be the same. If my story is one of 5 million in Canada and your story is one of another 5 million in Canada, that's 10 million people across the country. That's a third of our population. We're living a journey of recovery, either as an individual or as a family member, as a loved one. And the impact that has is pretty profound, right, when you take a look at that. But we don't talk about those things, right? So my passion is about sharing those stories and empowering others to have similar stories so that they can in turn empower others.
Well, thank you very much, Dan, for sharing your story tonight with us. Yes, and we do have some statistics out. We're going to add them to the webinar. I have the latest from Ontario on our stats for mental health and addictions. So we'll add that. But the one thing on there that really, it pushes me to even talk about this more, is they're looking at, there's going to be a 50% increase in our numbers of young people who are dealing with mental health and addictions issues by the year 2020. So Dan, unfortunately, you and I have a lot of work to do.
We do.
Because I don't want those numbers.
No, no, nor do I. And I think that, you know, they've done some great work around the globe with the things that we're learning more and more about, and what we're coming to learn more and more is that culturally and societally, the more that we are compassionate and accepting and understanding and educating ourselves societally around mental health and addiction issues, the better off we become. You know, it's proven in history. We've done it with cancer, diabetes, and HIV and AIDS. And as we become more compassionate and accepting and understanding, and we look at doing research into solutions, that's what happens when people get well. It'll be no different for addictions and mental health, right? But there's work in front of us for sure.
Yeah, there is. So hopefully you'll join me again.
I have a question for both of you. Just before you go, to speak to that statistic, what they're projecting, what's the one thing, Dan, and you as well, Catherine, what's the one thing you want people to take away from that? What's one thing we can all do to make that incorrect?
Well, my belief is the one thing that you can do is look at having healthy relationships with the people around you. So, because I think everybody has a role in recovery, and if you encourage, support, and really figure out what a healthy relationship is, I think that we'll be farther ahead. Because one of the things that I know in all of this work is that we all want to belong and we all want to have connection in some way. Mm-hmm. And the difficulty is, I always say, it's the bridge between. It's not really the person, because we're all in relationships. It's the relationships that ends up causing the difficulty in us having the connection. So all of us have the ability to help somebody else relate. And I think that's really important. And I mean, and I said, I know people complain about the texting and Facebooking and all that kind of thing, and it's a different way of relating, but there's still a way at human being to human being that we can make that kind of connection. And sometimes it's that one. It's I know in my own life, I've had to spend a whole lifetime learning how to do it. I didn't know how to be in a relationship that was healthy with somebody. I know how to be in an unhealthy one, for sure. Well, I know how that works, but even in that, I didn't have the skills to deal with the hurt. So I get very scared about connecting to people, and that makes you very, very lonely. So for me, that's a good part of it. When you get skilled enough to be able to deal with the hurt and the challenges and that kind of thing, and have some healthy relating skills, then we can move forward.
What about you, Dan?
Yeah, definitely, I like what Catherine's saying around being connected and allowing those connections to exist in a healthy way. And I think that we do that by talking to one another, right? By opening up that dialogue, by having that dialogue. And I think that through that dialogue, as more people become educated in those skills and how to have those healthy relationships, that becomes part of the problem, right? Is that we don't know how to have those types of relationships, right? We've either lost our way or we're just not having that type of a dialogue. And I think that through that dialogue, the more people that have that awareness, that are comfortable, that carry those skills and that compassion to one another, the better off it will be.
Well, I like what both of you said, and I think, Catherine, another point that you made in talking about your son, you said that there were times where he was not able to verbally communicate. So, in a way, I think allowing kids to text and use iPads give them an extra way to connect if you're paying attention. As a parent or as a spouse or as a caregiver or just as another human being, pay attention. You know, everybody's trying to connect in some way.
Yeah, even in that negative behavior, as I say, even in the negative behavior, they're still trying to connect.
You know, you mentioned at the beginning of the program, Catherine, that there's a difference in Canada between a dual diagnosis and a concurrent disorder, and I actually work with clients who present with dual diagnosis, so learning disability, and oftentimes those clients are either nonverbal, and they're always communicating, right? It's about learning how the other person is trying to communicate, and if you're in a different place, getting to a place where you can be understanding. Right?
Mm-hmm. That's right.
Those skills exist. So sometimes listening isn't just about what we hear. Sometimes it's about what we see. Right?
Yeah. And sometimes it's about what their behavior is, gives you an idea about what's going on. Absolutely.
Absolutely. Yeah.
Well, thank you again, Dan. And we'll do it again. Love talking to you.
Absolutely. You too.
Well, thanks to both Dan and Catherine. This has been Recovery Academy's Talk Recovery. Remember that Catherine mentioned the mental health and addictions information from the MHA Council will be available on the website, exactly where the replay of this webinar will be. Thanks very much. I'm Elaine Lindsay.